It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Take my hand and lead me to salvation. Take my love, for love is everlasting, and remember the truth that once was spoken. To love another person is to see the face of God. Hi, folks, I'm Sam Lesante. Interesting show for you today. We're going to talk about hospice. Now, I know a lot of you may or may not be familiar with hospice, but today we're going to give you a good understanding what hospice is all about and take it from a person who has used hospice. I have as my guest the CEO of the Hospice of the Sacred Heart, Diane Baldi, and the Chief Medical Officer, Dr. Ralph DeMario. Folks, thanks for coming on the Sam Lesante Show.
Always a pleasure, Sam.
Thanks,
Isn't
Sam.
this a beautiful quote?
It is a nice quote.
It's a beautiful quote. It talks about to love another person is to see the face of God. Every day, I guess hospice, people who are involved with hospice do that. Being on the board of Hospice of the Sacred Heart, which is one of my proudest things I like to say, being associated with this Hospice of the Sacred Heart. Hospice, okay, Diane, give me a Hospice 101 definition of what hospice is.
Well, hospice care, Sam, is a specialized form of medicine, of medical care, and there's so much talk about medical care these days. Hospice is about 25, 27 years old in this particular country where Medicare started being responsible for the payment of hospice care. It's for those patients who have a prognosis of 6 months or less, or a life-limiting or serious illness. If their physician prescribes and feels that hospice care may be a benefit to them, then the whole team of hospice professionals come in to help care for that patient and their family. Social workers, nurses, physicians, volunteers, therapists, to give that holistic approach to care in their home or wherever they call home. And it's Medicare sponsored. And there is the big thing for the Medicare piece, in which is most of our census is Medicare patients, it's a benefit that the patient nor family have to pay anything for. So that's really what hospice care is, that individualized care and care planning that we go into a patient's home or wherever they call home, if it would be a nursing facility, for example, and help deliver that interdisciplinary care looking at the whole person. Just not their physical care, but their spiritual care, their emotional care, any social needs that they may have. And that's really Hospice 101 in a nutshell.
Now, Dr. DeMario, you had a tremendous practice, fabulous reputation, and then you got involved with hospice, okay? And for the sake of our viewers, all right, how does a well-known physician such as yourself with such a great reputation leave the practice and get involved with hospice?
Sure. Well, I had been in private practice, like you said, Sam, for 21 years. Now, during that time, I had dabbled, so to speak, in part-time hospice work, maybe 1 or 2 hours a week, because at that time, a lot of the medical directors were kind of on a volunteer basis. But like Diane had mentioned, as the whole subspecialty of hospice has grown into hospice and palliative care, and now there's a board subspecialty specifically for this type of medicine, it's become much more recognized. And, when Diane and I have known each other for a number of years, but when she had started working with Hospice of the Sacred Heart about 7 or 8 years ago, it was during that period of time that we started to have similar goals in terms of what our career paths were going to be. And at that point, we had some conversations along with our chairman of the board, Dr. Bucci, at which point we start saying to each other, maybe at some point this is a part of the team I'd like to be on. And then, the entire concept of care in the Luzerne, Lackawanna County, and our 9-county area that we currently cover became so large that the more Diane and I spoke about it, we said, I really need to do this on a full-time basis. And now it's just become a passion in terms of helping patients and their families, like Diane had mentioned, on their end-of-life journey.
Why?
Well, I don't think there's any better thing that we can possibly do for people. We spend a lot of our time helping patients be born. We spend a lot of our time with pregnant women, a lot of our time with children, et cetera, et cetera. But I've seen in my career that it seems as though a lot of the care that we give to patients in the last 6 months or 12 months hasn't been as optimal as I thought it could be. So I said, dedicating ourselves to that journey for patients and their families, I think is just the right thing to do. It gives not only us a better sense of well-being, but we can see how thankful patients are to be able to get through that last 3, 6, 12 months with the kind of support that they really need to make that journey as easy as possible.
Diane, being involved in hospice, you know, you see a lot of things and you deal with a lot of people. Of course, we'll talk about the wonderful staff, and I mean the wonderful staff, a little later on the show. But looking at hospice and why and when should someone consider hospice? Because, you know, sometimes when you hear hospice, it's like someone saying you got cancer and you're going to die. Okay, let me just jump into a hole. Okay, thank God that's not the case. Okay, it's not a scary thing. Okay,
Sure.
So basically, when do we look at hospice?
Well, that's a good point, and a very good question, Sam. As a matter of fact, you and I have had this question in your own family as well. And my advice to people, and again, we in hospice often refer to hospice as the H word. It's the word nobody wants to say because people are afraid of it because they equate it with death. And having seen it on the other side, it's actually, we're companions on the road to that, and we help the patient and family along that way. My suggestion, and I think doctor has the same suggestion always, is if you think it's time, maybe it is, call a hospice, have somebody come out and have that conversation, do an assessment, do a review with the patient and family to see if you are ready. We have indicators, and we have standards from Medicare, for example, that tell us when we can admit a patient. But there are other options perhaps for you. But the people in the public are afraid of hospice care because sometimes, you know, hospice comes in and the patient may expire 3 days later, so they equate it with death. It's, as your experience has been, it's more than that, and it can be more than that. So my suggestion is if you think you may be eligible, all you have to do is call and let us help you make that decision for you.
So, Dr. DeMario explained why he left the practice to work full-time in hospice, because he said the word that you must have without question is passion. Because I'm going to tell you, anyone who's in any business, particularly in your business, if you don't have passion, you don't got it. Okay, and that's why I would assume that Hospice of the Sacred Heart has grown as much as it has. Why did you, Diane, as a registered nurse, correct? And, why did you decide to spend as much time with hospice and dedicate your life to it practically?
It has been my career, and as Doctor spoke before, we have known each other for a very long time, and I started as a registered nurse and had worked oncology, and I remember going into work and saying, well, you know, what happened to Mr. So-and-so, and nobody knew, and it was just an automatic thing for me to go to hospice because it was that multidimensional care. And I wanted to have the social work involved because there may have been a child involved or a husband or something. And it was just a natural course for me. And as Doctor spoke, there's a great passion, there's a great sense of self. And what I often say too is that people say, how can you work in hospice for so long? It must be so depressing, it must be so sad. It actually is just the opposite. The rewards are really on our side because we get to meet wonderful people and help them along the way. And our staff, I always tell them every day, at the end of the day, you can go home and say, I've made a difference. That's a great feeling, Sam.
There's no question about it. My wife, of course, Debbie, is a registered nurse.
Right.
I think nurses and doctors are like special people. I mean, it's a caring part of it. You know, sometimes people use it as a cliche. Oh yeah, but I mean, really getting involved, folks. If you just tuned in, I'm talking to Diane Baldi, who is the CEO of the Hospice of Sacred Heart and the Chief Medical Officer of Hospice of Sacred Heart, Dr. Ralph DeMario. Now, what about some of the things that trigger you for transitions? Okay, what palliative care and you know, the home, the hospice, and what are some of the things we should be looking at, and why hospice is really important for those who need it in our life. Stay with us. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. 24/7. Remember, watch us on ssptv.com. Over 1 million hits. Could you imagine it? Thank you so much for all the great comments on all our shows. Every local program we do, every show we do, which is seen throughout the world, is on ssptv.com. And this show on hospice, which is extremely important for you to know about hospice, is on our website. But before we go to our guest, Tomhicken Mountain Spring Water, folks, the official water of SSP-TV, Samson Productions. Starbucks uses this water. If they don't have it where you buy your water, ask for Tomhicken Mountain Spring Water, folks. It's fabulous water. And, yes, folks, I'm still taking this every day to Montevideo. It makes you feel terrific. 2 shots of it every day. Dan Marsala, give him a call. He'll tell you all about it. It's great stuff. Doctor, you should be using this stuff. Diane, I'm telling you, it makes you great. Okay, my guest, Diane Baldi, who is the CEO of Hospice of the Sacred Heart, and Dr. Ralph DeMario, who is the Chief Medical Officer. There's a statement here that says, Many people wait too long to decide about hospice care, but early referral can improve quality of life for those patients and their families living with a serious illness. Okay, respond to that.
Sure. Well, I wrote it. So that's that's one of the reasons, Sam, that I know it so well.
Yeah.
Couple things. Years and years and years ago, 25, 30 years ago, when hospice in the United States was first starting, almost 100% of those patients were cancer patients. Things have changed dramatically in the last 25 or 30 years. Only about 40% of patients referred for hospice care or have cancer. The other 60% have non-cancer diagnoses. So it's the things like emphysema and congestive heart failure and ALS and kidney problems, et cetera, et cetera. The biggest complaint that we hear from patients that we take care of is, I wish someone would have told us about the option of hospice care earlier. And that's one of the reasons that we had put that in our brochure, that you can improve quality, and actually statistically patients live longer with hospice care, probably about 29 or 30 days longer, because of any one of a number of different reasons, probably the level of care that they give. So we always say to people, if you're not sure, at least call and see if you are, if the family member is appropriate, if you do meet criteria, or just to have somebody come out and sit and talk about what your options for the future might be.
Do you believe in miracles?
Oh, I think that there's certain times that miracles may happen, but I certainly think that's a possibility.
I do.
I think sometimes when a person who is depressed, now again, you being in the expert in the medical field, depression comes many ways. And then when people hear good news or they surround themselves with happy things and they have a purpose, sometimes things happen in our bodies that make us heal ourselves. I mean, so when I say, do you believe in miracles, sometimes when a call to hospice that you were afraid to make that phone call, and all of a sudden hospice comes in, and then you come in and you do your thing, and so let's talk about that. Sure. What is the initial stages? Okay, I'm watching the show. I may have a loved one. It could be me. What happens when I make this call to 706-2400?
Well, the first thing will happen, you'll be put in touch with our admissions counselors and our admission nurses, and they come out to the home, to the nursing facility, wherever the patient is, and sit with the family, sit with the patient, and review all the things that take place. Then your next person you're going to meet is your RN case manager. They're going to help you and your patient set up what you need. That's what their first question is. What do we need? What do you need from us to help you get through the next week, the next 2 weeks, the next 3 months? How can we best help? Do you need help with your medications? Do you need help with equipment in the home? Do you need help with personal care, wound care? How can we best help you? And that's decided individually, which makes hospice very special. There's no cookie cutter care planning. You should really say what Lesante's need, what the DeMarios need, what the Baldis need today. So that's how it all takes place. And then as you've experienced, Sam, that care plan takes place. What you need today may be different from what you need next week. So it's all individualized, as patients and families are all individualized.
And when the person calls, because your checklist here, Ralph, okay,
Yes.
I make frequent phone calls to my physician. I've noticed a significant weight loss in the past 6 months.
Sure.
I take medications to lessen physical pain. So I could call and get that information from him saying, look, I don't know if I
Meet this criteria.
Yeah, meet the criteria of correct.
Correct. And you know what, when our admissions counselors go out, or when the patient talks to their doctor, remember, we don't exclude the doctor from this as well, because you always need a doctor's order. But when we start hearing things like, I've had a cancer diagnosis and I've opted not to get any further chemotherapy, or I've had 3 or 4 falls in the last month, or I've been in the emergency room with another pneumonia with my emphysema, or I have a new wound on my back, a new bed sore, or I'm really, really weak, or I have pain that I can't get under control. When we start hearing all of those triggers, we say to ourselves, wow, it looks like this particular patient isn't going in the direction of being completely cured, so we want to refocus our attention on helping them through the last 3, 4, 6 months of their life. So when people start to hear those things, or family members, or physicians, that should be the light bulb that goes off that say, you know what, I wonder if you couldn't benefit from the team of professionals that come in with a hospice service.
And when I said, do you believe in miracles, there are certain people that, in their families, that when they call hospice, okay, and hospice comes in, Then you begin, if hospice comes in, if a person needs hospice, then when your people come in and you get together with the families, okay, then you begin to speak to, and you start giving the comfort. There are some times, unfortunately, that some family members don't speak to family members, okay, which is unfortunate. Miracles happen when the person is sick and hospice comes in. Now brother has to come in and we have to talk to sister-in-law, brother-in-law, cousin, or whatever. And all of a sudden, you're now talking about the care of grandpa, dad, whatever, mom or sister or brother, okay? Now they begin to see a whole different perspective. So the person who is sick is feeling comfortable, but now seeing their family becoming involved. Have you seen that?
I have seen it, and actually I refer to it as gifts of the dying. And,
Yes.
And
Yes.
that's the miracle you're talking about.
Yes.
And then you have families reunited, or somebody's made amends, and it's the way that happens, and it's truly as a gift of the dying. We see it a lot.
And it's such a gift. It's such a gift. People don't know that. That dying person is seeing things that he or she is feeling so good about, okay?
And still has a lot to give at that point.
Exactly.
Yeah, that's right.
And sometimes they've given the biggest gift by having these people in and you being the catalyst. On a personal note, okay, my mom passes, okay, and me like an idiot, okay, I called you guys, right, and should have called you probably 2 months before, okay, but saw the entire operation. Yes, I'm a board member. When Frank Bucci told me about this project and et cetera, he said, put me on board, I'm going to be there, okay? But it was a whole different perspective that I should have called, and me being on the board, okay, dummy Sammy, what I saw what you people did when you came in was, and it wasn't because I was a board member, that's what you do all the time.
Yeah. And remember, Sam, it wasn't just for your mom. It was also for you and your family. And we always try to remember that our unit of care, who we take care of, is not just the patient, although that's a huge focus, but also you, who may have been having some trouble dealing with this issue, or for your wife, or for your children, et cetera, et cetera. So you take that whole unit of care and make sure that everyone is on that journey at the best possible place.
You know, Ralph and Diane, you know what else I saw? I saw such sincerity, such honest, not a phoniness, not a, well, we have to do this job. I saw this girl who took, the nurse who took care of my mom. I mean, she came to the mass, she came to, only it was 2 or 3 days she was with my mom. I mean, and this lady was so involved emotionally, even stopped in my office about a month ago, how you doing? I mean,
isn't that nice?
she didn't have to do that. I mean, little things like that meant so much, where hospice plays such a part. Folks, if you just tuned in, I'm talking to Dr. Ralph DeMario, who is the Chief Medical Officer of Hospice of Sacred Heart, and Diane Baldi, who is our CEO. 206-2400 and the website hospicesacredheart.org. When we come back, talk a little bit more about the hospice, what it means to you, and why you should call them if you need them. Stay with us. Thanks for staying with us, folks. I'm Sam Lesante. You're watching the Sam Lesante Show. My guest, Diane Baldi, who is CEO of Hospice of the Sacred Heart, and Dr. Ralph DeMario, who is the Chief Medical Officer. Doctor, again, I went through it, using hospice with my mom, and those people, if they don't know they use hospice, it's 706-2400, folks, not 206. Bereavement. Let's talk about bereavement.
Well, one of the things we say that's very nice about hospice services as opposed to other forms of care that take care of patients that die is with hospice services, one of the wonderful, wonderful, wonderful services that comes with hospice care is that even after your loved one passes away or dies, we don't just say, well, good luck, Sam, I hope everything's okay, and if you ever need us again, call us. One of the wonderful programming that we have that's part of the Medicare hospice benefit is bereavement. And that's specifically to help you as the family member to get through the grieving process after your loved one has passed on or has died, even after having receiving hospice services.
Critical, so important for
Certainly.
people to grieve. The Dragonfly program, okay, I love this.
Yeah.
It's a great program.
A child is old enough to grieve when he is old enough to love. Isn't this fantastic? Talk about the Dragonfly program.
Well, just to go on with what Doctor was saying, bereavement is required through Medicare, that we have to for 13 months after the patient dies to make contact with the survivors to help them. Well, I believe at Hospice of the Sacred Heart we're a little bit overachievers in general, but especially in our bereavement programs. So we have several bereavement programs that not only help widows and widowers, they have a 6-week structured course that they take part in, which is all our bereavement services and programs are free to the community, whether we care for the patient or not. It's a community service. So there's that program. We have community support groups in the evening, but Dragonfly is now into its 6th year, and that's for children aged 6 to 12 who have suffered a loss, a grandparent, a sibling, a mother, a father, any loss, and then those children come to a program which is 7 weeks, and they bring an adult, either a parent or a grandparent, and then the adults work through their grief, the children work through their grief, and then they come together at the end of the night to see and to utilize the tools that are taught to them by our bereavement counselors to how to help children through this loss. And what happens then, the adults are helped as well. Yeah. So it's a great program. That's sponsored through grants and also through Hospice of the Sacred Heart.
You have a list here of our service promise: patient and family-centered care, excellent in pain and symptom management, inclusion of access to end-of-life care, organizational excellence, performance improvements. But here is what I want to touch on for the last couple of minutes: education of staff and community. You know, I'm going to be braggadocious here. Our hospice is Sacred Heart, and all hospices are fine. But, you know, we become a leader in northeastern and central Pennsylvania because of the people we have. And let's talk about the staff, okay?
Well, our staff, and you would know best, Sam, as well as being a board member, and Doctor and I work with them every day. It is my privilege and pleasure to watch them work every day. They are passionate, as we used the word before, committed, dedicated, and they would do anything for our patients and families, but also for each other. We give them the education that they need. Dr. DeMario and Dr. Vanston do educational programs for them all the time. Many other members of our staff do as well, but I think we are the region's leader in hospice and palliative care because not only of our staff, but the tools that we've given them. So our staff is second to none.
I agree with you, and you know, as a board member, I wish I could speak for all the board members. You know, the chairman, Dr. Bucci, but you know, I always want the people who are involved with hospice to know how much the board appreciates what they do. Okay, yes. And I'm sure, I hope I speak for all the board members, but we see what is accomplished in the lives. Especially, there's a couple of board members such as mine, and I think. Dominic, the Naples family, was involved, you know, or heard some people use the Hospice of Sacred Heart. It's just a great thing. So, well, thanks for coming on the show, Diane.
Sam, thanks for having us.
My pleasure. Folks,
pleasure, Sam.
It's Hospice of the Sacred Heart. Just give them a call, you know, if you think you need them. It's 706-2400, and it's hospicesacredheart.org. So I'm going to leave you with this quotation that I stated in the beginning of the show, and think about it, folks. Take my hand and lead me to salvation. Take my love, for love is everlasting. And remember the truth that once was spoken. To love another person is to see the face of God. We'll see you next time.